Well, good day, everyone. I am Lei Ravelo, Senior Global Health Reporter for Devex. Thank you so much for joining us today at a very timely panel about strengthening the World Health Organization during the 74th World Health Assembly. Um, the WHO has been, on the forefront of tackling the COVID pandemic, but in doing so, it also has faced a lot of scrutiny and there have been a lot of calls for reform. Member states of the WHO have put forward proposals to strengthen the organization, but also different panels and committees. Today, we're going to discuss some of the proposals similarly raised by different governments, but also different committees. And I'm really excited because we have such a brilliant panelist who've agreed to join us today to talk about these proposals, but more importantly, how we can make them happen, how we can move forward with these proposals. All of them really do not need a lot of introduction, but let me just briefly introduce them to all of you. We have Amanda Glassman, Executive Vice President and Director for Global Health Policy at the Center for Global Development. We also have with us Suerie Moon, Co-Director of the Global Health Center and Professor of Practice in the International Relations, Political Science Department at the Graduate Institute in Geneva. And lastly, we have Björn Kümmel, Senior Political Advisor on Global Health Affairs at the German Federal Ministry of Health. Björn is part of the WHO Executive Board and currently chairs the member state-led working group on WHO sustainable financing. Panelists, welcome and thank you for joining us today. So right on. So there's a lot of calls to strengthen WHO over the years, but again, during this pandemic, in one of my interviews, one of the experts asked me, what kind of WHO do countries want? And I guess for a start, I'm going to tweak that question slightly and ask each of you, what kind of WHO does the world need? Perhaps I can start with Amanda.
Well, I think first, we need a World Health Organization that has voice and independence and the ability to set scientific standards and to check the quality of their implementation in countries at all levels of income. So that means not just, Malawis of the world, but also the United States and Canada and China. And that sort of global independent mandate really is what makes reform so difficult because in some respects, the WHO was built to help with this idea that infectious disease burden is mainly a problem in low and middle income countries and is not a major threat in the high income countries, and that therefore the tools that the WHO had did not need to be effective in those high income countries. Well, we've seen differently. So we need to retain the value added in low and middle income countries, but we also need to think about how the system works in the high incomes.
Suerie?
Thanks very much. I really agree with what Amanda has been saying on the importance of an independent WHO that can operate at arm's length from the political pressures that we know it will face from member states and from others, especially in the middle of something like an outbreak of infectious disease. I would add on top of that we need WHO to play what we sometimes call the stewardship function over the entire global health system. So there has to be somebody who's in charge of taking the 10,000-foot view and seeing what is working and not working well, because we know that it's not just governments or WHO, it's an entire very complex ecosystem of state and non-state actors who together jointly produce health outcomes or disease outcomes, which may be more accurate. And in order for WHO to be able to play the stewardship role, it does indeed need that degree of independence again from all these different stakeholders in order to be able to have a clear-eyed and arm's length view. At the same time, we need WHO to be politically courageous, and that rests a lot on the leadership. I don't think that's something that can be legislated at the end of the day.
What do you have in mind, Björn?
There's not much to add, so I fully agree with Amanda as well as Suerie. I think the first answer would be a WHO that really plays its role as the guardian of public health and global health. a leading and coordinating agency for global health, the leading authority, I would say, an actor who engages and is able to lead practically everybody who engages in public and global health. So that is also has the possibilities to engage with everyone, but not only on paper. And I think that's more or less the tricky part here. So someone who is leading and coordinating and has the capacities technically, politically, and financially to play these roles and to fulfill the world's expectations. And I think we will, in our further discussion, potentially address this, at least from our point of view, discrepancy in between what the world expects from WHO on the one hand and what it can fulfill on the other hand. And there's a major gap in between, which needs to be addressed in this reform agenda or strengthening of WHO agenda. And I think, so there is a discrepancy between what is written on the paper and what is the reality.
It's interesting that all of you are, talking about independence, really a strong focus on independence, WHO being a leading authority. I just, there have been a lot of proposals that have come out, but one of them is actually, and recently with the Independent Panel for Pandemic Preparedness and Response, one of their proposals was actually allow WHO to publish information on outbreaks immediately without countries' approval. I wanted to direct that, I guess, to Suerie and ask, how can we, how can we move with that proposal? Well, what needs to be done there?
I think that's one of many very specific and concrete proposals that the independent panel put forward that underscores this broader theme of WHO autonomy from member states, or at least a certain degree of autonomy. I think that in reality, no matter how much we, for example, may reform and strengthen WHO financing and governance, WHO cannot actually just turn around and willy-nilly publish information that is highly sensitive about a member state without engaging in some degree of consultation and diplomacy. I'm not sure that that's actually realistic. And that's because one of the key assets that WHO has is actually trusted relationships with governments around the world. And a really fast way to undermine that trust is to turn around and publish information that governments don't want you to publish. So I do think one of the interesting questions that comes up about information sharing is what are the other channels besides relying on these interstate mechanisms that might get information out faster to the world at large that can complement what is a hugely important and irreplaceable intergovernmental process. But that intergovernmental process, I think, is necessarily going to have to move a bit more slowly than, let's say, the digital era may allow us to move, as the independent panel, rightly emphasized. And so some emphasis on technology and data scraping and non-state actor sharing information, I think, is really interesting if we can look at that as a way to complement what WHO needs to do at a government-to-government level.
There's another linked proposal to that as well, sending experts on short notice to investigate outbreaks. And we've seen, with the COVID-19 pandemic, how long it took to negotiate that kind of access in China, for instance. Amanda, do you have any ideas how realistic that we can actually move with that proposal?
Yeah, well, I wanted to just add on your last question for a second, and that is that we can imagine that some of the other players in the system could create better incentives for putting data series in the public domain as a matter of course that would enable some spotting of anomalies, even if it's not officially reported by people at large, right? If you can imagine that, and this doesn't work for the Chinas of the world, but if you're reporting respiratory illnesses and flu and all of that on a weekly basis, the way the beautiful UK and European data sets do, and you can just go there and check and you can see exactly when this problem started to rear its head. So just to say that we might think of other ways to promote sort of routine data sharing that would enable that doesn't require like an official to acquiesce to share certain kinds of data. On your question, remind me what your question was again about IAEA type inspection possibilities. I think this would require some kind of a pandemic treaty or a revisit of the international health regulations. I don't think it's a bad idea, although it does suggest that one would have some routine intelligence function that would be collecting these unofficial sources of data. And the question is, when would you have cause to invoke such an inspection? I find it hard to imagine that the Chinas and the United States of the world will agree to this, but I think it's not a bad idea. So we'll see how things evolve. You know, it was managed to be done by the IAEA because it was considered such a major communal threat that it was worthwhile to be able to do these kinds of things. Although so far, you know, we know where those kinds of inspections occur, right? They occur in countries that don't have the possibility to resist it. So it requires a lot more thought, sort of what is practically possible.
You mentioned about, you know, whether you asked the question whether the US and China's of the world will actually agree to this kind. I wanted to ask Bjorn, you know, will the Germany of the world, you know, agree to this kinds of proposals? You agree to have independent experts shortly right there, you know, to investigate if there's any outbreak that comes in Germany?
Well, let's put it this way. I think, well, whether it will be possible in the very end to have the world agree to a new mechanism that allows for on-spot inspections, I don't know, on short notice within 2 weeks, let's say. I don't know. We will see whether that's possible. Whether the German government could agree to that, I think this is one of the key things that we believe could be in any mechanism for the future. Indeed, we believe on-spot inspections should be possible through WHO, obviously involving then a trustful relationship with the relevant member state. Certainly, that is one lesson to be learned. It should be possible for WHO. If WHO is supposed to play the role as the guardian of public health, then WHO needs to have these possibilities in hand. How realistic it is in the end to agree on such a consensus, we'll see. Obviously, there are voices against this because this obviously also always infringes to some extent state sovereignty. But what do we get in the end, all of us? And I think we need to be thinking more creatively regarding incentives. So what do we buy through our more or less state sovereignty investment here? And that is, we buy ourselves a safer world, obviously, if that happens somewhere else. Certainly, this is always tricky if your own country is involved. I think then there's always a change in perspective. And I guess that does not only apply to the Chinas and the USAs of this world, but practically to all of us. And we have to be realistic there. But that is not to say that we should not agree to a new mechanism allowing this on paper and then putting pressure on the one member state that is facing an outbreak. I think I would like to come back to what Suerie also said with regards to the balance. We have to strike a right balance of autonomy on the one hand of WHO, which is a member state driven organization in the end, and the trusted relationship. And obviously WHO has always different hats on. WHO normally operates in a world where it has a country office and engages on a day-to-day basis with the health ministry, potentially even the heads of states in specific cases. And then really, I mean, the greatest value of WHO is this large network of country offices where it has this trusted relationship. And that we shouldn't put at stake. But on the other hand, when it comes to an outbreak, obviously there are different interests here with regards to the one member state that experiences an outbreak and with regards to the 193 other member states who have an interest in getting real-time data and an objective view of what happens on the ground. And I think we have to balance that out. I doubt that inspections is the only solution here, yeah, but it's part of the solutions.
Thank you so much. You know, one of the things that happened, you know, with the recent investigation in China is the trust that was placed on that investigation. And we know there have been a lot of questions, you know, regarding the report of the international experts. How do you see, how do you build trust as well in these kinds of investigations? That kind of helps as well the WHO in kind of strengthening, building trust in the organization as well. Anyone would like to jump in on that?
Probably others are more qualified, but I'll stick my spoon in. I think, having a very clear protocol and evidence-based protocol would be one way to handle this. And I think the practice of having a roster of very highly respected, well-known, well-accepted scientists and social scientists as part of the team that the whole set of countries could kind of authorize ahead of time. Those might be some ways to reduce the heat when it comes to the moment of the inspection, because they will have already agreed to the way it will be done and the individuals that would be part of it. And we should learn from I was looking at OIE, which is the UN Organization for Animal Health, and they do these inspections all the time, and they have sanctions associated with failure to disclose data. And those sanctions also have kind of consequence in terms of the action of countries that import animal products from those countries that are having an outbreak problem or a data disclosure problem. So it seems to me that we have a model that we could look at that might give us some practical ways to go forward.
If I could jump in on that point, I think Amanda raises some really important points about looking outside the health sector, or at least outside the human health sector, for examples, not only animal health, but in terms of weapons control, also environmental crises. We know that in other regimes, it's actually considered normal. And it's kind of a widely accepted international norm to have, for example, international inspections, sharing of data, sanctions. I think one of the things we've really suffered from in the health sector is a hesitance, and I might even say a nervousness about using international law, binding international law, much more. And I think many people watching this will be familiar that in the health sector, we basically have the Framework Convention on Tobacco Control, we have the IHR. We don't have a whole lot else in terms of binding international laws dedicated to the protection of health. And so this is really something that I think we have to overcome, and we can get a much longer discussion as to why is that. But there's a lot of lessons to be gleaned from elsewhere. And I do think that if we can come to a point where agreeing to an international inspection ex ante, far in advance, becomes the norm. And it doesn't mean that you've done something wrong, and it doesn't mean that you've violated trust. That the trust, it's too late to build trust in the moment of crisis. That trust and those relationships and those norms have to be established in advance. And that's what I hope we can do with the window of political opportunity that's open now.
You mentioned, Suerie, about, and Amanda as well, looking outside of the health sector. I read recently the report of the working group on sustainable financing. And, one of the things that caught my attention is there was a presentation by Gavi and I think it was the Global Fund, if I'm not mistaken, and just presenting how they're funded and their replenishment. I want to just ask Björn, perhaps, at what stage are you in this whole discussion of sustainable financing? Are there already concrete proposals that you can perhaps give us a bit of some examples that came up in your discussions as chair of the working group?
Thank you, Jenny. Well, to be honest, there are concrete proposals, but not coming from the working group so far. So we haven't moved that quickly. But maybe to put this into the broader picture, what the working group tries to address is indeed this discrepancy in between the expectations that the world has vis-a-vis WHO and the given abilities, the capacities, the financial capacities. And it's currently, I assume the broader audience knows that WHO has a budget of roughly 5 billion, but it's to a large extent funded by voluntary contributions, by highly specified resources, and only currently what is it, below 20% of its funding, of WHO's funding, is predictable. So WHO practically plans on a 2-year basis, and they don't know whether they will be able to run their programs. They run short-term contracts, people even in the emergency program. And we all know Maria van Kerkhove. She just received a long-term contract because to a large extent that's the human resources model that WHO needs to run due to the unpredictability of finances. Yeah, and on the other hand, while we all applaud WHO and we highlight its leading and coordinating role and normative functions, etc. But for some reason, member states so far only contribute very, very limited sustainable finances. And that's been the issue not only recently, but for the past decades. And the trend has been growing. So practically the unpredictable voluntary resources have been growing, and the predictable, long-term funding, primarily through the membership fee, has been stable for the last decades. And the sustainable financing working group tries to address that. And we have in our mandate very clearly pointed out that we are supposed to look whether there are specific essential functions that should be funded no matter what, which should be seen as a priority and should be funded through the limited sustainable finances. And the rest would then be funded through other mechanisms. And this is where we are currently looking at. That we will have our third meeting in June, so following the World Health Assembly. And I expect that especially through the launch of the different reports, and in particular the report of the IPPR, the Independent Panel for Pandemic Preparedness, there will be a new momentum and a new dynamic also with regards to sustainable financing. And that is also the one body that has produced a very specific recommendation. So the IPPR says the way, and this is also, we had the IPPR and also the Global Preparedness Monitoring Board and all the other panels present in our working group, and there was one common line that they all had with regards to sustainable financing, and they all said that the complete system is rotten. So you shouldn't try to reform a small bit here and a small bit there, but you have to bring in the broader picture. The way member states are currently, or we all finance WHO, doesn't make much sense to them because it's unpredictable and it makes it very, very hard to adapt to emerging challenges and outbreaks, obviously. Just to give you a sense, the emergency program, for example, is only 1/3 financed. The contingency fund that was created after the Ebola crisis that is there to allow WHO to more or less extinguish the fire without prior need to beg for finances has never reached its financing goal, is chronically underfunded with only a very limited donorship. So all these things are the reality for WHO, and still WHO manages quite well with regards to what the real de facto abilities are. So the IPPR says the entire core mandate of WHO should be financed in a flexible, sustainable manner. They are arguing in favor of a substantive membership fee increase, I think by 2 or 3 times. And the rest, the last third, should be financed through a replenishment model. And and this is, I think also why it was quite interesting to invite Gavi and the Global Fund, because they obviously finance themselves fully flexible through a replenishment model. So this is where we currently are. And I think that after the World Health Assembly, we will be inspired by these recommendations, and there is the possibility that the working group will look at these specific recommendations coming out of the panels.
I think one follow-up is that, it's not just the independent panel. A lot of different experts have already expressed, how to fund the WHO is actually increase assessed contributions. So why not just take up that, call by different experts, not just the panel, for member states to increase their assessed contributions, which has not really increased for quite a long time now.
Well, indeed, because there is a general trend among member states, and that does not only apply to WHO, and that is called zero nominal growth. So many member states have stick to the policy of not increasing their membership fee to any of the UN bodies. So this is not unique to WHO, I guess. However, currently COVID shows us that WHO is chronically underfunded or not receiving the right funding, and also shows us how important a well-functioning and well-staffed WHO is, and that the world just cannot afford a WHO not to be empowered. Yeah. And I think we also, in these overall debates, obviously an increase of assessed contributions by 2 or 3 times sounds huge, and they are huge, obviously, compared to past levels. But if we are comparing this to the broader picture, what we are currently, the entire world is currently investing in the response, in the recovery, I think someone said it's considerably nothing. It's almost peanuts. Just to give you a sense, if we are looking at the membership fee of WHO, what 194 capable member states contribute and provide to WHO through their membership fee per year, and if you look at that per world citizen, what we are investing into each world citizen through our membership fee of WHO per year, it's 6 cents per year. And the question is that sufficient to staff and to equip WHO right? And I guess we all share the answer no. We have to invest more, and that investment, I think that's also a key message that we hear from the IPPR and the other panels. This investment is a great investment because it allows you to invest less into potential further outbreaks later on, or needed recovery investments later. So compared to what we would need to invest, it's a great investment.
I wanted to throw in, the question as well to Amanda and Suerie. What other options are out there really to help address the funding challenges of WHO?
So I think one thing I would say is that it's not just a funding challenge of the World Health Organization. It's a funding challenge of the function of preparedness and response to infectious disease outbreaks in the countries of the world, first and foremost. And so when you look, many countries do not have the kinds of surveillance systems that enable them to even know how many people are dying. And I think, when I look back at the enormous investment in HIV/AIDS, for example, we've had 25 years of HIV/AIDS investment, and yet the countries that are the most affected are not able to accurately count the deaths in the same year period from HIV/AIDS. Okay, and that's not for lack of money in some respects. It's about what we think is important and trying to drive to results. So I think part of it is a financing issue because, of course, developing a good vital statistics system is very, it's a hard work. It takes time. It takes money. But I also think the key point is to the results that we want to see in terms of global health security and preparedness, that those standards are set and that the financing works to achieve those results. Because, how can it be really that this is, a previous pandemic that we still haven't got a handle on, and that this is part of the answer. I mean, I think the assessed contributions have to go up, and there's probably appetite for that. It's from 1 billion to 4 billion between all of the countries that are members. We can probably do that without a huge lift if we follow the independent panel's reports. But we have to see the current funding situation of the WHO as an expression of the lack of confidence that the member countries have in the organization's ability to deliver certain kinds of results. And so there is, it's not just a money issue, it's a leadership. I was happy to see that the independent panel also talks about the importance of merit-based recruitment, potentially of simplifying the levels of bureaucracies. There are more assistant director generals now at the WHO than at any time in the past. There is still a piece that's about kind of efficiency, about making it a science-based organization, and about delivering on some key mandates very clearly. And that, that is why we see so much ad hoc giving to the WHO. So the question is, can this replenishment idea meet those needs of the donors? But it's not so much meet the needs of the donors, it's can the organization deliver on these things in a way that is credible and that is
Suerie?
observable in the public domain.
Suerie, do you have any thoughts?
Yeah, I think the my concern over the years has been actually less about the total amount and more about the way in which the money is structured. And I think that when those who have money tie strings to it, when they earmark it, it's not just about wanting to see certain efficiency or results. I think it's also about control. And different funders want to control different things. You know, some governments or non-state funders care a lot about, you know, certain diseases or efficiency, or having, let's say, somebody that they know and trust, let's say your own national in a certain staff position. Every single government wants their in, right? You want your in WHO. You want a way to get access to information and influence decisions and be able to, you know, pick up the phone and call somebody when maybe there is a suspicious disease outbreak happening in your territory. I mean, there are lots of reasons why governments and others want to influence WHO, and money happens to be a way in which they can do that right now with the current system. And so I think, you know, we all began this panel talking about the importance of independence and autonomy. Money is one way in which to strengthen that. To me, what's interesting is that it's one of the few reliable ways to do that. It's actually low-hanging fruit to implement, you know, whether it's the, you know, 20% to 2/3 jump in earmarked and unearmarked assessed contributions or another move. It's actually feasible, right? There are lots of questions about how to make WHO more independent, better technically, et cetera, that money cannot solve. But here's something that we actually can solve. And so to me, what's frustrating is that indeed we've been talking about this for 20 years. There is huge consensus. After Ebola, there was actually, you know, this was put on the table. Let's increase these assessed contributions by just a little bit. Björn will remember the exact numbers. And member states should know. So I don't think it's about money. I don't think the efficiency questions purely answer, you know, what's going on here. I do think that at the end of the day, everybody wants a bit of control. And so how do we move past that mentality, right? How do we move past member states and others saying, we all want our little piece of influence, our little pathway to influence into this organization, which plays a hugely important role. And for me, one of the weaknesses of the replenishment proposal that the independent panel has put forward is that Gavi and the Global Fund are financing institutions. They're not norm-setting institutions. And this is a very, very different function that WHO is asked to play. Versus these other entities. And that norm setting function, in my view, has to be ironclad protected as much as we can possibly muster in the way it's financed. And I'm not convinced that replenishment is the way to do that. But I mean, I take the point that that's a way to mobilize, you know, every few years, a lot of energy and excitement about the organization. But I think we have to think very carefully about how is this a unique intergovernmental organization that is different from any other global health initiative out there.
Thank you so much. I think we don't have much time. I would have loved to ask more questions to our panelists, given the large proposals out there on strengthening WHO. But really interesting because we have, you know, I think everyone unanimously wants, you know, an independent organization really. But there are factors, you know, this is a, you know, there are factors that are at play. It's not an easy road to just, you know, implement all of these proposals. But hopefully the World Health Assembly will be able to move forward with some of them. I'd like to thank our panelists, again, Björn, Suerie, Amanda, for sharing your insights with us. And I'd like to invite our audience to please continue to watch our series of events during the World Health Assembly this week. Thank you so much and have a good day.